Hi, Maria Rebozo Lapine coming to you from our new Cafecito Time con Equality Health Studio with my very special guest, Livia Arevalo, nurse practitioner from our very own care team. Remember, Season 3 features a new talk show style format with 10-minute segments that are on demand to fit your busy lifestyle. So you can tune in whenever it's most convenient for you. In this episode, Livia and I are going to be talking about colorectal cancer, commonly known as colon cancer. What is it and how can we help prevent it? Did you know that colorectal cancer is the second leading cause of cancer deaths in the US among men and women when we combine those deaths together? One day, I was talking to Livia about this and she tells me, Maria, colon cancer is preventable if detected early. So why are we still dying from it? This is why it's so important to know how to help prevent colorectal cancer. And that is why I have invited you, Livia, so that you can help us out, so that we can have more information, so we can take care of ourselves. Welcome. Thank you for being here with us today.
Thank you so much for having me here at Cafecito con Equality Health. It's always a pleasure.
You know, Livia, one of the barriers to screening is that I don't have any symptoms. What can you tell us about that?
Colon cancer or colorectal cancer is one of those cancers that it's a slow growing cancer. It takes about 10 to 15 years for the cancer to grow. So because it takes a long time, people may not be experiencing any symptoms whatsoever, or some of the symptoms that we experience could be related to something else. We may think that could be related to something else. For example, symptoms that could be colon cancer are change in bowel movements, having diarrhea, constipation, or having stools that are too thin. Those are symptoms of could be symptoms of colon cancer. Seeing blood in your stool is another example of a symptom. Unintentional weight loss, feeling tired, fatigued most of the time or all the time could be a symptom, again, of colon cancer. Having abdominal cramps or having the sensation of having a bowel movement, going to the bathroom, but still having that sensation that you still need to go, those are symptoms that could be related to colon cancer.
It's interesting because a lot of the things that you mentioned are things that I feel almost every day. So what is your recommendation? When should I go see my provider?
My recommendation is to start paying attention to those symptoms that your body is telling you. Do not ignore them. Do not think it's something else. A common example is diarrhea. We may think, oh, I ate something bad on the street and it made me sick. Mm-hmm. But it may not be that simple. It could be related to colon cancer. So if you're experiencing any of those symptoms, I strongly suggest that you schedule that appointment with your provider. Mention those symptoms to your provider so that your provider can order the test that needs to be ordered. And in addition to that, it's always a good idea to go visit your provider once a year and have that head-to-toe exam and have those labs so that you're good to go.
You know, and you mentioned talk to your provider. I know we sometimes feel a little bit embarrassed about talking about diarrhea and poop and urine, but
well, Maria, let me tell you that when I'm with my patients, I always address the bowel movements. And it's not saying, are your bowel movements normal? It's going into what color is your poop? What color is your urine? Because it gives us so many clues at what's going on. The funny thing is that response from my patient, it's normal color. But what is normal color? Is it brown, green, white? Because if it's white or black, for example, then it's something that we need to keep on looking at it.
That's interesting. Thank you for sharing that with me. I want to talk now about some of the screenings because I recently had a screening. I had a colonoscopy. And when I was talking about it to my friends and family, you know, some of the words that they mentioned were like invasive, unpleasant, embarrassing. And I can tell you, I felt those things as well. I was carrying a big stress knowing that I had to have this done and that I was 5 years late because we start at, what, 45 years?
Now we start at 45. Last year or 2 years before, it was at the age of 50, but those guidelines have changed. And now we start at an early age, again, because colon cancer is so preventable and treatable.
And tell me about what are those different screenings that we can do. We talked about colonoscopy, but I know there's some other ones that we can do at home.
Of course. So we have colonoscopy, the one that you mentioned. And for that, there is some preparation that you need to do at home so that your colon is clear and so that your provider can visualize your colon. The procedure itself, it takes about 10 minutes, and that's it. And after that procedure, if everything is nice and clean and clear, you're good to go for the next 10 years. And if your provider finds something like polyps, those polyps can be removed and then sent to the lab and analyzed, and will follow from there. The other two type of screenings that we have is two different types of screenings that we can do at home. One of them requires collecting stools for 2 or 3 days and then sending those stools to the lab within specific number of days, otherwise it's not valid. If everything is clear, then you need to repeat that test within 1 year. But if something is off, then that screening itself needs to be followed by a colonoscopy. The third choice that we have is another one that you can do in the comfort of your own home. That other test looks for something else, and it's good for 3 years. And if everything is okay and clear, you need to repeat that in 3 years. But again, if they find something, then it needs to be followed by a colonoscopy.
Livia, you've given us a lot of great information, but I want to talk a little bit about the risk factors as well.
That's a very great question. So there are some risk factors associated with colon cancer. One of those risk factors, for example, is being overweight. If we are overweight, it increases our probabilities of having colon cancer. The other factor is our diet. If we're having a diet, eating a diet high in fat, processed food, or red meat, it also increases our chances of developing colon cancer. The third one is smoking. Smoking increases it. And the fourth one is consumption of alcohol. So those are risk factors that are associated with colon cancer.
But you're not telling me to give up my steak. You're not asking me to go and register at the gym and go work out 5 days a week, correct?
Not at all. What I'm telling you is that once we have this information, then we can start making changes. And those changes can be in small steps. An example will be, instead of having red meat every day, maybe cut it down to twice a week. I'm not asking you to give up on your red meats or your processed food, not at all. Exercise and weight loss, for example, you need to find something an activity that you like, that you enjoy, so that you can continue doing it every day or most days of the week, and then 5 minutes to start. Then increase it for 10 minutes and then 15 minutes.
That's great advice. Livia, I want to thank you so much for being here with us. I think the information you provided is so valuable. Thank you for taking time from your busy schedule to being here with us.
Thank you.
I want to thank you for joining us today. I hope you found this information useful. Remember, you are so important to your family. Talk to your provider. Schedule a screen for colon cancer. It can save your life. And be sure to subscribe to our new Cafecito Time con Equality Health YouTube channel so you'll know when the next Cafecito Time con Equality Health is ready to be viewed. Thank you again, and cheers to your good health. Salud.
Salud.